He captained his high school basketball team despite being 5'7", and then cured vasculitis and became head of a federal agency where he was admired by 6 presidents. And he went from enemy to hero among AIDS activists. Who am I talking about? Well, Dr. Anthony Fauci, of course, who's just announced his retirement after 54 years. Welcome to CareTalk, America's home for insightful debate about healthcare business and policy, and a top 5 health podcast. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. David, you aspire to become 5'7".
Well, John, with my basketball shoes, I do think I make it there, by the way. But who's counting?
What is going on with the wonderful Dr. Fauci? He's retiring? Who said he could do that?
That's what people said. Is Dr. Fauci retiring? He's only 81. Now, John, the thing is, he says he's actually not really retiring. He's just moving on, to the next step in his career, which is not yet announced. But he actually stayed on because President Biden asked. I think he was probably ready to retire at the end of the previous administration. But no, he's stepping down, John.
I think it's a brutal job to be helping lead the country through a pandemic crisis that it went from a pandemic to kind of a political battle where you're not just playing a role as the leader of the scientific and public health efforts, which he's extraordinarily successful at, but really getting hung up with some sort of bizarre political challenges. Although this isn't the first time that public health has become political, David.
John, I think it's a good opportunity to go through and just talk about, Dr. Fauci's achievements and accomplishments. He started actually in the federal government when he was 27. Now he's 81, which, quick math, John, means he spent 2/3 of his life there. And he's accomplished a lot over that time. And I think this episode gives us a chance to go beyond what people have heard in the most recent public health emergency and talk about the arc of his career, because there's a lot there.
It's a great point. He's a great immigrant success story. His Italian parents emigrated parents or grandparents immigrated to the U.S. His father was a pharmacist. He went to one of the fabled Jesuit-free high schools that you can only get into based on admission, but they charge no tuition at all. Regis, where the whole notion of being of service was the reason why he committed to become a doctor while actually in high school. And then he went to the Holy Cross and then Weill Cornell for his medical background. But throughout his career, even early on, he was deeply committed to healing and helping improve the ways we heal folks who are suffering.
John, there's a good number of people that are committed to that kind of a course of action. There are very, very few, if any, that have actually had the same level of accomplishment. So, sometimes people ask me, what are Dr. Fauci's achievements? Because they hear I defend him sometimes in the current crisis. There's a whole bunch of things. Maybe I'll tick off a few and then we can discuss them in a little more depth.
Sure.
One thing is that he actually created effective treatments or cures for a number of formerly fatal immune diseases, including vasculitis.
He's not just a talking head. That's a really important point. He was actually of the 2 or 3 million scientists who have published in the 80s, he was ranking as the 13th most quoted, which is to say he's published such effective and important articles across many domains of infectious diseases and particular diseases that he's one of the most widely referred to scientists in the world. And then he literally went, I think, the vasculitis. Can you explain what vasculitis is, David? I know the statistics on it, but do you know what it is?
Yeah, well, luckily we don't have to worry about it too much, but it's sort of an immune response that used to kill something like 90% of people that got it. And with a new drug regimen that Dr. Fauci put in place, it's like 95% remission rate. Sure. A lot of his research in the area of immune response, including autoimmune. So there's also a number of rare diseases that he was able to basically, develop treatments for, including by using resistant medications. But
even more common ones, David. I mean, he was one of the innovators around tuning up the doses of anti-cancer drugs that have turned some of these drugs from treatment to sort of managing the disease. I mean, cancer is pretty common. In rheumatoid arthritis, which is a really painful condition that affects a lot of people. The association identified him as probably the most important scientist affecting the many people who are suffering with RA, with novel treatments. But perhaps his biggest, the public got to know him with slightly longer hair and slightly and with different glasses during the AIDS epidemic, just the early stages under Reagan. Do you want to talk a little bit about that? Because this very few people have more than one kind of dance in the public where where that kind of, you become that prominent, particularly as a doctor.
Well, John, as you know, as we said, he'd been in the government for over half a century, and he's been the director of the National Institute of Allergy and Infectious Diseases for 38 years. So that takes us back to the AIDS, HIV pandemic. And in that time, he was very involved with this disease as it came out, and it was a real kind of a mystery what was going on. And he made a lot of enemies in the LGBTQ community. Larry Kramer famously called him an incompetent idiot and a pill-pushing tool of the medical establishment. And basically, the AIDS activists were very very hopeful and very aggressive about getting experimental treatments made available.
Yeah, I mean, let's put it in context, though. Larry Kramer was a very famous AIDS activist and writer. I believe he actually had AIDS. I can't recall precisely, but he was a really thoughtful, aggressive, prominent. But at the time, there was a real fear among the LGBTQ community that people weren't taking this disease seriously because it was sort of a gay disease, not a disease that affected, as it actually does, the rest of the population. And they were being singled out and perhaps not properly served. What they were pushing for is the aggressive use, to your point, of new treatments, and frankly, needed to, through organizations like ACT UP and others, make sure that people were focused and prioritizing this at the time, absolutely deadly mortal disease. And so I think they were motivated by the deaths of their friends. And of course, anybody they probably would have attacked anybody who would be perceived to be slow walking, whether they were or they were not, treatments. But what's remarkable about that one, David, is that now he's seen as a hero in the community about pioneering drugs and helping kind of shotgun them through the system. And Larry Kramer actually ended up identifying Dr. Fauci as one of the heroes of the crisis. He
said he was the only true and great hero there. And what Dr. Fauci did is he made these experimental treatments available widely. He wasn't in charge of approving drugs. He wasn't working for the FDA. That's their job, the Food and Drug Administration. But he had an opportunity in order to move things through quickly. Now, an interesting contrast, John.
The other interesting thing I think from that period is he also made a point offline, without the camera's presence, of directly meeting with activists, and he never lost track of how the importance of a public narrative that's tied to a private narrative about what he could do and what they needed to see and what they should do as a government. He's a deeply committed connector and really felt very personally, I think, that he needed to talk to the activists and the people who were suffering.
John, let's actually note a parallel from that time and see what's changed. And I think it's more what's changed in terms of technology and the environment we're in, and rather than what changed with Dr. Fauci. There were some things that Dr. Fauci had said toward the beginning of the AIDS epidemic that didn't end up panning out. So one was that he warned that he thought that routine close contact among family members could potentially spread AIDS. Now, he corrected that within about a year, which was noted as sort of very fast for anything that you're publishing in a medical journal. If we contrast that to what happened with a more recent public health emergency, where he had made some comments, ironically, saying about, didn't expect that there was asymptomatic spread, didn't think necessarily that masks were needed. He corrected that a whole lot faster as the data became available. But in this era of social media, where there's, instant analysis and everyone's all of a sudden, an expert, plus you have, people, especially in the Senate, from the other party that, or from the president's party at the time, that are ready to attack you, and it's a whole different ball game. Plus, with the lack of effective leadership from the very top, he really got himself into a bad spot.
Yeah, I think that there is a really interesting, and Peter Hotez mentioned this in one of our earlier, Dr. Peter Hotez earlier podcasts. There is a demonization and political backlash for anybody who's going to be sort of taking there's a reason why we have the Statue of Liberty, not the Statue of Social Order in New York. I mean, we are a country of people that fervently and sometimes violently protect their own personal liberties. And so, obviously there's going to be politics associated with public health because it's public health. But science is not perfect. It is an evolving narrative of the truth as we know it right now. And there will be inconsistencies if we are actually continuing to do research to tune up and improve what we know to care for and heal more people. I do think that one of the challenges in public health is finding a way to frame the fact that this is the truth as we know it right now, but perhaps not the final or the ultimate truth, because otherwise activists on any side will assume that inconsistency means insincerity or dishonesty. And it doesn't. It often just reflects the facts of the moment.
Well, John, I think, this isn't about Dr. Fauci specifically, but if we look at the whole public health establishment and why, for example, the Centers for Disease Control wasn't so well prepared to deal with a recent public health emergency, it's that they are used to saying, okay, here's a problem. I'll go study it and I'll come back and I'll tell you the answer once I've had a chance to properly analyze it. Now, that leaves a big vacuum when people need information to be able to act on. And then if you sort of say what the truth is at the time as you know it, it leaves you vulnerable to or inconsistent or whatever later. Now, I think the public health agencies can do a better job, but it's also the case that others are looking to attack. And that's only partly what the public health agencies can do. We also need some goodwill from others. It was interesting what Dr. Fauci said in his goodbye press conference. And he said, this is a quote, "When I see people in this country, because of the divisiveness, not getting vaccinated for reasons that have nothing to do with public health, as a physician, it pains me. I don't want to see anybody hospitalized. I don't want to see anyone die. Whether you're a far right Republican or a far left Democrat, it doesn't make any difference to me."
Yeah, I mean, the reality is he was beloved and respected by Reagan and the Bushes, and he was beloved and respected by Obama and Biden and Clinton. I mean, this is a guy who's not political at all. And I think one of the interesting things and challenges for Dr. Fauci, who we got to just thank him for his service. That's a long service for all of us, and for his amazing achievements. He really is actually one of the better communicators I've ever seen on public health issues. He comes across very sincerely and believable, even amid the biggest attacks on him in 2020. He still was one of the most trusted people in America. I still think he is one of the most trusted public professionals in the country. And it's because he is plain spoken. He speaks directly, and he can explain the facts in a way that the average American can consume. And I think the vast majority of people thought, he's someone they can trust. In fact, I would say, other than Ashish Jha, he's probably the best public health professional we've had in the last 20 years. I mean, the CDC director Walensky has a real problem communicating, and people don't trust her. And
John,
it's less with the facts.
Just because she's from Massachusetts, don't give her a hard time. Now, here's another contrast, John.
Well, we should also talk about, we've talked about AIDS. What about Dr. Fauci's achievements in MERS, Ebola, SARS? I mean, he's been involved in some of the toughest things we've had to deal with.
For sure. So one area was after 9/11 where there was concern about attacks, with white powders and so on. He was involved in leading the drug development, in that period of time. And luckily we haven't really had to use it, but he kind of quickly mobilized, drugs for biodefense. And there's a number of things that didn't get to the same level as the recent public health emergency.
I mean, by white powder, you're not talking about cocaine. You're talking about anthrax. There was a real fear post 9/11 that it was relatively easy to develop designer drugs on a bio basis, and he was involved in actually creating a pretty massive infrastructure around biodefense. And there are all these fake anthrax and real anthrax threats. Again, the range of things he's been involved in to help protect us against the hemorrhagic bleeding disorder, the Ebola that is just so terrifying. The avian flu.
Swine flu too, John.
Places with swine. Yeah, no, it's just remarkable, and I think that there's a reason why George W. Bush gave him the President's Medal of Freedom. Do you remember what that was about, or have you lost track of that one, David?
Well, John, I think you can get that for most recently you could get that for sucking up to the president, right? But that wasn't why he got it. Do remind us, John.
Do you remember what he got it for?
Was it for PEPFAR?
It was. And what is PEPFAR?
So, John, one of the things that happened, I think we have a couple contrasts here we can go out on. One is that after fighting, HIV/AIDS in the U.S., there was a realization, hey, we need to be able to look at the rest of the world, which is actually where there's, very high incidence and huge impact from AIDS, and particularly in Africa. So PEPFAR was actually called the President's Emergency Plan for AIDS Relief. And actually, I don't like a lot of acronyms. I like that one because like PEP, providing some energy, and FAR for something far away, and really made a huge difference of allowing essentially generic drugs to be developed and manufactured, distributed with all the infrastructure that's needed to really make a difference on HIV in Africa. And that's extremely well, deserved. John, I want to add maybe to end things with a little bit of a contrast. There's been a lot of discussion about who's going to testify before various committees in Congress and so on, resistance even to subpoenas for that. I asked Dr. Fauci about what's going to happen now that, the Republicans are, some of his biggest critics are controlling the House of Representatives, if only barely. And he said he'll be happy to testify. He says, quote, if there's oversight hearings, I'll absolutely cooperate and testify before the Congress. Obviously, you may not know, but I testified before the Congress a few hundred times over the past 40 years or so I will have no trouble testifying. We can defend and explain and stand by everything that we've said. So I have nothing to hide.
I love that guy. I mean, one of the things that he said in one of his later interviews was that the people asked him, what do you want your legacy to be? What do you want to do? And he talked about teaching, and he hopes that his legacy will be an inspiration for others to serve in public health. And gosh, with the kind of achievements he has, curing diseases, protecting the United States, withstanding withering attacks, helping create breakthrough solutions for deadly diseases, and then helping protect. I mean, I think the PEPFAR thing alone has saved up through 2020 over 20 million lives, largely in sub-Saharan Africa, from the ravages of AIDS. He really is an inspiration.
Well, that's it for yet another edition of CareTalk. We've been speaking today about a 5'7" giant of public health, Dr. Tony Fauci. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service.